After witnessing the attempted assassination of former President Trump on Saturday evening, whether on TV or social media, many parents are grappling with how to talk to their children about fear, gun violence, and how to feel safe. And Dr. Darien is back here now breaking it down for us. So how do parents start that conversation? What's the best approach?
You know, in medicine, we train to talk about these difficult conversations, whether they be positive news or negative news. And I think the most important thing to remember is that if someone is old enough to ask a question, they're old enough to receive an answer. Granted, that answer can be age specific, but I think a lot of stress comes in the absence of information. You leaving your children to draw their own conclusions, that can lead to poor outcomes, more stress, and so making sure that you're answering their questions and they're walking away feeling like they understand.
I mean, I was surprised. My daughter's 2.5, and as this news was unfolding, we turned the TV on. She said, "Why is he bleeding? What happened to former President Trump?" She had all these questions, which I couldn't even believe a 2.5-year-old would have, but she noticed the blood. So I'm curious, like, what tips you have for us to, you know, how to walk kids through what they're, you don't even realize what they're taking in sometimes.
You don't, and these are times where, as adults, we're still trying to manage them ourselves. I think, number one, asking where that child is in their understanding, focusing on open-ended questions. What do you know? How do you understand this? What does it make you feel? Also making sure that you help them understand their emotions. I think for children, sometimes those feelings, they just don't know how to name them. So helping them give them names can help them better communicate with you, and then also help them identify when they're stressed. And then, of course, limiting their access to screen time and social media, that can bring its own stress and that can bring its own trauma. And then making sure you're acknowledging other people that can help out, talking to their primary care provider. Sometimes they might want to talk to a friend or an aunt or an uncle instead of you as a parent. I think managing what is best and most comfortable is the best outcome and effort.
And she's so right. 2.5 years are smarter than we like to give them credit.
So much smarter.
So much smarter.
Granted, they have so much more access than we did at that age, and so you have to be cognizant of that.
And they know the normal things. They know what it is to boo-boo their knee, so they see blood. They know blood.
Absolutely, absolutely.
All right, Doc, thank you very much. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for Dr. Darien at ABC GMA3.